Hello, I'm Dr. Sundari Mase, Sonoma County's health officer, and I'm here to share the latest updates in coronavirus in our county with you. Here's my report on cases as of yesterday, August 11th. We have 3,825 cases, 1,785 are active, 1,989 have recovered. We now have 51 deaths. There's been one death reported since the previous 24 hours. And the number of coronavirus tests that have been completed need to be updated still at this time. If you're sheltering in a family situation or with others, remember to not gather in groups if it's not necessary. We know that in large gatherings, COVID-19 is more likely to spread. This means if you go out in a group to the grocery store, then you might be at risk. So try to just send one person to do the shopping. If there are less of you going out, there are less chances to contract and spread COVID-19. If you need to do an errand, try and make sure your trip out is worth your time. Make sure you think of everything you might need coming up and try to make a larger rather than multiple small trips out. Try to get groceries so you only have to go out every week or two as opposed to every couple of days. Every time we go out, we're taking a risk to either contract COVID or infect others with COVID. Please only go out as necessary. Stretch your trip out so you don't have to make multiple trips. And really try to avoid gatherings with non-household members. So after months of COVID-19, we're all struggling to just keep up. Things feel like they change so fast. It can be really hard. I know, financially, physically, emotionally, takes a big toll. That's why I want to take some time to remind everyone about Sonoma County's warm line for mental health. It's very easy to get overwhelmed in times such as these. The constant reminder of COVID-19 may make you feel anxious, isolated, and stressed, even when you're at low risk for getting sick. It's important to monitor the signs of stress, anxiety, and depression in yourself and your loved ones and know how to get help. Some common signs include feeling nervous, restless or tense, unable to concentrate, having insomnia, having headaches and muscle tension in shoulders and neck, having decreased or a little energy, and having changes in appetite, either over or under eating. Sheltering in place is tough and can feel lonely. Even if you're sheltering with others, it can bring about its own stressors. Even children may pick up on this and experience their own signs of depression and anxiety. There are many ways to help you manage these feelings. Talk with people you trust by contacting friends and family through social media, FaceTime, phone calls, or email. Social distancing does not mean emotional distancing. Maintain a healthy lifestyle as much as possible. Include proper diet, sleep, and exercise. And do your best to stick to it. Spend time outside each day and stay healthy by breathing fresh air, going for a walk. Contact a counselor or other healthcare professional to seek help with your feelings of anxiety and or depression. If it's an emergency, call 911. Check out all the local resources we have on socoemergency.org under the mental health and wellness button. And don't hesitate to schedule an appointment with a mental health care provider, even if you don't have insurance. Many counselors are providing virtual appointments by telephone or video conference. You can find out how to access all these services on our website. You can also call 707-565-2652 for free and private support if you or someone you know is experiencing emotional stress and anxiety during COVID-19. Open 7 days a week from 10 a.m. to 7 p.m. And there's counseling from a mental health professional available in both English and Spanish. Our community question for today, now that we're in fire season, in the event of one, what do evacuations look like during COVID-19? With hot days and high winds approaching, we've been hearing concern about potential evacuations. We'd like to share information with you about potential fire evacuations. First, I'd like to clarify the difference between an evacuation order and an evacuation warning. An evacuation order means you need to leave immediately, and an evacuation warning means you need to get ready to leave. If you have mobility issues, you should consider leaving even if under an evacuation warning. We learned from the Kincaid fire that early evacuations save lives. For safe physical or social distancing. To be sure you are notified about any evacuation orders and warnings, please sign up for SoCo Alert. For more information, please check www.readyforwildfire.org and/or our website, socoemergency.org. Stay safe. Talk to you again on Monday. Thank you.